we'd like to now invite Dr. Abhay Jere for his talk on, for your talk, basically. Would you like to use the mics? Let's hear it for Chief Innovation Officer, Innovation Cell, Ministry of HRD, Government of India, Dr. Abhay Jere.
First, I would like to thank Apollo Hospital, Dr. Sangeeta, Dr. Ganpati for inviting me to this conference. I'm also thankful to Dr. Sangeeta for her very kind words during introducing me, and her stress on innovation. So today I will be talking about just two projects which I'm currently involved in big way. I conceptualized those projects and I'm trying to take them forward. And the reason why I'm going to talk about these two projects is because I believe that majority of you could join us in these projects or in these initiatives as stressed by Satyanarayan sir and Dr. Sangeeta in a public-private partnership mode. So next slide, please. I use this. So I don't know how many of you are aware that at any given time point in India, we have 80 lakh students who are doing engineering and technology. 80 lakh students. And every student has to do a 6 months project in his 4 years of his academic period. So if you do back of the envelope calculation, the amount of energy which gets invested is somewhere between 5 lakh to 10 lakh person years per year. And what happens to that? It all goes down the drain because a lot of copy pasting happens, a lot of theoretical work happens, and work happens which may not be very, very relevant. So the question we were trying to ask was how we can use this energy, this creativity which is there in our youngsters for development of our nation. And that's where we conceptualized a simple Smart India hackathon. Dr. Sangeeta already spoke about your hackathon, which is here. And now Smart India Hackathon has emerged as the world's biggest open innovation model. So the concept is very, very simple. What we do, we go to people like you, we go to various government other agencies, from ISRO to DAE, Ministry of Road Transport, Railways, and we ask them for problem statements. Because what we have realized while talking to our technology students is that they first think about the technology and then think about the problem. And in the real case, it has to be vice versa. Identify a problem and then try to solve it. So many times it happens that our youngsters try to solve problems which really need not to be solved. So in India, we are at a very peculiar state. On one hand, we have millions of students who are capable of solving problems or who want to solve problems. And on the other hand, we have zillions of problems which really need to be solved and which don't require rocket science kind of solutions. So whether we can get solution providers and people who are keen on giving problem statements on a single platform. So during first year, we got about 600 such problem statements, and extremely interesting problem statements from various departments. And about 42,000 students participated. In second year, we went to state governments also, and about 1 lakh students participated. And last year, this year when we did Smart India Hackathon, in March, we had a couple of lakh students participating from almost all major technology institutions in India. So I'm taking this opportunity, because you can see the kind of, the magnitude of the initiative which we are trying to do. 54,000 ideas from 34,000 teams. One team has 6 students, 2 mentors. That kind of scale which we are working on. We have a software edition, which is 36 hours. But we have a very, very innovative hardware edition also, which we actually conceptualized last year. I don't know how many of you might have seen one program, Big Boss. You know, some bunch of people are put into some house. And then the program revolves around the tantrums in that place. So we said, can we use this concept for providing or for promoting innovation and new ideas, conceptualizing new ideas? So we identified about 20 workshops. And we said that we will put students into those workshops. We will give them everything there. And they have to go in with the concept and come out with the product. So we identified about 200 such teams, our 3 rounds of screening. And we gave them whatever they wanted. Design engineers, product engineers. You just ask and we will give it to you. Some students ask for buses, tankers, boats, and we actually give them that. So now about 27, 28 startups are coming out of it. So it's a very, very innovative model. So the reason I am here is one of the themes, very important themes for us is healthcare. Because my background is in the area of healthcare. Although I have joined Ministry of Human Resource Development recently as a Chief Innovation Officer, before joining, mine is a lateral entry. So before joining, I used to work for Persistent Systems, and I used to head our healthcare R&D. For last 8, 10 years, I was working in the area of personalized medicine, personalized genomics. So this is what we do. Prime Minister every year joins. He, at around 10 o'clock, he speaks for a couple of hours with the students across India. And these were some of the private companies last year. And Apollo Hospital was one of the entities which gave us problem statements last year. So we are open this year. And I would request you all to actually join us by giving problem statements. We take care of all the logistics of students. We take care of everything as Government of India. What you need to do is give a good problem statement to us. And if you find a solution, you have to pay prize money of 1 lakh rupees to those students. Everything else we take care. We invest anywhere between 12 to 15 crores for this. Student travel, we take care of everything. So it's a best opportunity for you to actually engage with us in a PPP mode. And what you will get? You will get branding. You will get access to the best talent in this country. So healthcare, as we say, is one of our key theme areas. Great problem statements from you will be of great use in actually ensuring that we develop something which is really relevant. The next initiative on these lines, which we are again very, very passionate about, is Manav. I don't know how many of you are aware of this initiative, but it's again using our demographic dividend, the power of our students, to create a complete human atlas of our body. You know? So what we are doing here is, I don't know how many of you are aware, but if you go to PubMed, and if you just scan for number of papers, There are about 5.5 million papers which are published in area of human biology. And there are about 86 different databases which don't talk to each other. So the question we are trying to ask here is that whether we can actually use students, our BSc students, our MSc students, our B.Pharm students, our medical students, our biochemistry students, our veterinary students, to actually read these papers, these 5.5 million papers, and extract data in a very structured format so that we can create a macro level to micro level map of human body. Whatever, based on the information which we have. So from organ level, tissue level, to cellular to subcellular level. And there will be a lot of missing information because it could be, or it could be an extrapolated information. But we would like to identify where are the gaps. And we are going to put out list of those gaps around which other students can do their PhD or MTech projects or M.Pharm projects to fill those gaps. So eventually, we envisage, we will like to see something like a Google map of a human body. And it's possible. And it's possible because India has the advantage of demographic dividend. We need to learn how we can use the power of the youth, of our youth, to actually do some real cool science also. So that's our approach, and we would be more than happy for if you can join us in this initiative also. So initially, we are working on skin model, trying to establish the entire platform. And our basic studies have shown, so I am working very closely with PSA on this. Department of Biotechnology has funded this project. Principal Scientific Advisor to Prime Minister, Dr. Vijay Raghavan and me are very, very working closely with this project, on this project. So what we believe is this, that if once we have this map, it will have huge role to play in area of personalized medicine, drug discovery, clinical trials, and entire human biology can revolve around Project Mana. So these are some of the things which we are doing. I will be more than happy to interact with you, to answer your questions, answer your queries regarding either of these initiatives, and explore how we can partner with you all in taking both these projects forward. Thank you very much.
Thank you very much, Dr. Abhay Jere.